This is not really a video on autonomic dysreflexia. I know I put it in the title, but what this is really about is a connection between the fascia and the sympathetic nervous system, how it points to a connection by the way this particular condition functions. Work in the manual therapy world, body work, fascial stretch therapy, whatever you want to call it, it gets some criticism, and rightfully so. It should. It has to. If it wants to be a real profession, it has to take criticism. And we do have current research. We actually have a fair amount of current research that shows what we do is effective. Mechanotransduction, osteopathy, the fascial world, lots of evidence, but it's not common knowledge, and this is something you simply have to work against. It's new, therefore it's not well known. You really should have to justify what you do. You should justify the validity of what you do to the average person and other medical professions alike, because your ability to talk about it and explain it in a sensible way means it is something that is worth being common knowledge, something we should all know. And if you can do that, if you can talk about it by finding a common ground, speaking a similar language, this is even better. And it just so happens that autonomic dysreflexia opens this door, becomes a point of meeting where two people or multiple people can understand the same thing, and it makes it a lot easier to come to the same conclusions. So here is the short version of autonomic dysreflexia, the very short version, I should say. What happens is that there is a spinal cord injury in some way or another. It happens to be above T6, but it's a spinal cord injury. And through that, there is a loss of communication, a loss of sympathetic nervous system regulation. And that sympathetic nervous system is something that increases the blood pressure, heightens the blood pressure. And with this loss of communication, we lose the ability to inhibit, to drive down the blood pressure, to reduce it to a safe level. And in the case of autonomic dysreflexia, it is incredibly small things, seemingly unimportant pains, that can cause these autonomic dysreflexia episodes or attacks. Such small things that you would never consider them. In fact, most of the time, this is an uncomfortable position, a seated position or a laying position. Maybe a shoelace has been tied too tight. A bedsheet that they're laying on, it's slightly wrinkled underneath. That's skin irritation, bladder and bowel overfilling. Of course, these are main problems as well, but seemingly innocuous, seemingly unimportant things that normally would never cause any problems can cause highly increased blood pressure. Normally the body would stop this blood pressure from ramping up, in fact, so significantly that it becomes life-threatening. And in that situation, of course, it's best that the doctors take care of it. It's best that the surgeons take care of this, because that's what they're professionals at. That's what they're highly skilled at. Where we want to look at this, we want to look at the relationships between what causes it and what the effects are, and what that really means to our connective tissue. All of these causes are of a peripheral body nature. Skin breakdown, changes in skin pressure, changes in pressure, all of these causes show that the tissues feed back into the sympathetic nervous system and change the way it works. This is, in fact, a constant feedback into the sympathetic nervous system, into the spinal cord or the central nervous system. And it is supposed to be inhibited by a healthy, fully functional person. It is supposed to be inhibited, of course. And so you could say that it's unimportant, therefore. You could make that step. But do understand, this is everyone you know, every person, and probably most animals, that is doing this feedback system from the skin, from the tendons, from the muscles, to all the fascias, the joints. It's all feeding back in and changing just slightly the way the sympathetic, the blood pressure, the blood flow system works. We, in fact, evolved for this to occur, and it took a really long time to do that. It would be way cheaper, easier to build the body without having to run this system. It would be much more effective. It would be cheaper to run, and it would be cheaper to build, less nerves, less wires. So the fact that it's there at all means it must be relevant information, even if it's being inhibited largely. Even if the effects are being diminished constantly, it's still there. It's still read, and it's still reacted to by the sympathetic nervous system, and then further by the central nervous system. So therefore, it's a component of the sympathetic nervous system, and a part of what's regulating that same system. If then sympathetic nervous system is part of what regulates blood flow every second of every day to our organs, it means that our fascia, our connective tissue system, and the positions of our body are part of the regulation of health. Do whatever you want with all that.